Hi, welcome back to the Moballise Physiotherapy Clinic. This is the fourth video in our neck mobility series. In this video, we will be looking at treatment of your neck mobility. Let's go. Let's get you mobilised. So to start with, let's have a recap of the neck movements of extension, flexion, side flexion, and finally rotation. These are the neck movements that you used in the assessment of your neck mobility, and these become the basic fundamental of treatment. So we can move through these four movements of the neck and use those to mobilise the joints. This is just mobility, so no muscle work. Firstly, into extension, all the way up, all the way down. Straight back down into flexion, through the range of movement you comfortably can, over to the side for side flexion on both sides, and then again both sides for rotation, turning your head. Once you've done that, go back to that craniocervical flexion that we looked at before and mobilise that one. You can do it lying down, first thing in the morning, last thing at night, whilst you're lying on your mattress with no pillow is absolutely perfect. A really great technique to find that position halfway down your neck, C3 and 4, pop the edge of a towel right on that site, grip the towel firmly with both hands out in front of you, and if you pull with one arm whilst you relax the other, you can use the friction of the towel to help to mobilise neck. You can do this into all four exercise movements. This one is rotation, and you can see just drawing on the hand as you turn will give you a little bit of what we call overpressure at the end of the range of movement. So just turn normally, and as you approach the end of the range of movement, you just draw a little bit harder on the towel and it will help you to turn. Now you remember the point at the top of the neck, just coming off the bottom of the head, that was your C1 point. If you place the towel in position and just draw the tension and then push back into it with your head for 10 seconds, that can really help to relieve tension in and around the neck area. You need to do all of these mobilisation exercises as often as you can throughout the day. Ideally aim for 10 times for 10 seconds at a time. Now there's no muscle work involved here, so no straining, just movement. The muscles, if you remember, you have the paraspinals running down the side of your neck, all the way up and down on both sides, and then you have that muscle, levator scapulae, attaching at the top two bones, coming all the way down and attaching on the corner of the shoulder blade. Now these muscles will really respond well to some tough tissue massage. Your fingers in there and dig deep. You want to be doing that, again, as often as you can remember throughout the day, for 10 times a day preferably. Just 10 seconds is plenty, and ideally when you're already soaked up in the shower or in the bath, you look in there with your fingers, it'll feel great. This is a mobility exercise and a stretch combined for your neck, especially at the top of your neck where it goes into your head. You want to tuck your fist underneath your chin there, place your hand behind your head and then draw down with your hand. It will help to stretch out the muscles and pull those little joints apart a touch as well. Take your hand up over your head and draw it to the side. This will stretch out all of those muscles down the side of your neck. You remember when you did your assessment for the side flexion in your neck. This one here is for that other muscle group, the levator scapulae. So hand behind your head this time, overlapping your ear, and then you turn your hand and your head, pulling forwards, and find that stretch. Hold it nice and steady for 30 seconds, come back up, and we call these the red light stretches because they're perfect for doing in the car at red lights. There you are. Everything that you need to know in order to start basic treatment of your neck at home to improve your neck mobility. Keep referring back to this video to refresh yourself on the techniques and to make sure that your technique is still good. Remember, any treatment plan relies on frequency rather than duration.
Just doing something for 10 seconds, 10 times a day is much more beneficial than doing it once for 10 minutes. We'll see you in the next video, which will be on rehabilitation, where we start strengthening the muscles in and around the neck. Until then, thank you for watching. We'll see you soon.